Good afternoon, dear students. Today we'll discuss physiology of muscle tone. As per the NMC competency PWA 10.4, it is mechanism of maintenance of muscle tone. So let's see the definition first. It is defined as partial state of contraction of a muscle in a resting state. Usually when we are giving a stimulation to the muscle will show a response by the contraction, but under resting condition still muscle is having some state of contraction, that is called as the tone. So it is a partial state of contraction of a muscle. Today we'll discuss the regulation of muscle tone. As we know, basic regulation is coming from the spinal cord. So that we have learned in detail, that is a stretch reflex. It regulates the muscle tone at spinal level. Now so many descending tracts are coming down from higher one which are controlling the muscle tone. So today we'll also discuss the supraspinal level of regulation of muscle tone and applied aspect, that is hypotonia and hypertonia. So let's start this discussion with different experiments to prove that there are different level of regulation of muscle tone. This is our most basic sketch of spinal cord. This is the muscle spindle, sensory nerve. This is our alpha motor neuron. This is our gamma motor neuron, which is supplying the muscle spindle. Now a basic stretch reflex, when you are giving a tap on the tendon of any muscle, there is generation of action potential in the muscle spindle, which will travel down the sensory nerve and stimulate alpha motor neuron, and there is a muscle contraction. So that is a reflex action. Some descending tracts are ending on gamma motor neuron, which will again stimulate the muscle spindle, generation of action potential there, and reflexly muscle will contract through alpha motor neuron again. And some tracts are ending on alpha motor neuron, which will excite it directly. Okay. So this is the final common pathway, that is the alpha motor neuron. Now let's begin with one experiment. We'll cut the nerve. You'll see once the nerve is cut off, what will happen now? There is loss of tone and loss of reflex. That will indicate that the tone basically is regulated at the level of spinal cord. So this experiment proves that it is at the spinal cord. If the spinal cord is destroyed by whatever means, by crushed injury or by section, in this condition also tone is lost. So this indicates that the most basic stretch reflex or tone is regulated from the level of spinal cord. Now let's try to find supraspinal level. What is the contribution of supraspinal level in muscle tone? Again by this alpha motor neuron and gamma motor neuron. Now we will take a section at this level. If we cut the spinal cord, what will happen now? See, reflex is exaggerated. That is hypotonia. So tone gets disturbed and we get hyperreflexia. That means there is a control coming from the top. So let's try to find by different experiments what is the level of control from the top. That is a supraspinal level of regulation of muscle tone. Now in this experiment you can see this is our basic level. Hypotonia, loss of reflexes with available of everything. Means despite everything is available, but when it is cut, we'll find that there is a loss of tone, loss of reflexes despite everything is present. Cortex is present, basal ganglion is present, cerebellum is present, this is present, but despite that, if the nerve is simply cut off, all tone is lost. So this is the lower motor neuron lesion. Now if you are cutting this top level, this is exaggeration, that is hypertonia, okay, and hyperreflexia. So through this experiment, it indicates that control is both at the lower as well as the higher level also. So this is classical upper motor neuron lesion. Now let's segregate the different tracts which are ending. This is our basal ganglion. So this is our main descending tract that we label as corticospinal tract. This is one tract which is coming from the vestibular apparatus, that is vestibulospinal tract, which is having control from both the structure, that is vestibular apparatus and cerebellum. This is coming from the reticulum arising in the pons, called as a pontine reticulospinal tract. This is coming from the medulla, again from the reticulum, called as a medullary reticulospinal tract, which is having influence from, we can see one influence coming from this cortex. One influence coming from basal ganglion. So this brainstem is basically under control from the higher centers. One influence is coming from cerebellum. So you can see here all three are basically exciting this reticular formation. Now this is our red nucleus, which is nothing but a sibling of cortex, that is cerebrospinal tract. Now let's do one experiment. Let's try to remove the cortex. So we are simply removing the cortex. It is called as a decortication. This is called as a decortication. Cortex is removed. Now let's see what happens if cortex is removed. So we are doing this in experimental animals like dog, cat or monkeys, and try to find what is the influence of this on the tone. Now you can see here these three are influencing on this. So ultimately, because of this, three inhibitions that's coming on here on our spinal cord. So now let's see what is the effect. Now you can see one of this effect is gone now. One positive influence was, and reinforcement coming from the cortex is gone. So because of this, you can see one of this becomes a minus now. Out of the three, now it is only two are remaining. So let's see what happens because of this. Muscle tone increases. So it is called as a decorticate rigidity. So it is very mild. So we will see in such patients, especially after a head injury or any hematoma, you will observe that the patient is having increased muscle tone. That is called as a hypertonia or rigidity. So this is because of cortex is removed. So it is called as a decorticate rigidity. So in decorticate, what are the observations? There is no spinal shock as spinal cord is intact. Mild rigidity. Hypothalamic function is normal. So if you observe that patient is having rigidity and temperature balance is there, that means hypothalamus is intact. Important thing what we observe is inability to react in terms of past experience. Memory is affected. Means learning is affected basically. So this is basically the picture of decorticate rigidity. Now let's do the second experiment. So this indicates that basically cortex is having a role in regulation of tone. So this is the one of the important supraspinal member which is controlling the muscle tone. Now let's move forward. Now in this second what we are doing section here, okay, at this level. So it is called as a mid-collicular decerebration. Cortex is, means whole cerebral cortex is basically removed. So at this you can see this is the level. So here we are cutting So now in this we can see, so it is called as the decerebrate rigidity. Now in this actually what is happening, two influences have gone now. So you will see in this, the cortex as well as basal ganglion, now both of them are now not functioning. So because of this you will observe here, out of the three which were reinforcing the descending tracts, only one is remaining. And here also you can see negative influence of only one. So because of that, rigidity is stronger or more rigidity as compared to the decortication. So it is called as the decerebrate rigidity. Muscle tone increases. Now in this we will do one more experiment. Here this we are doing deafferentation, nerve is cut off. When nerve is cut off, deafferentation rigidity is totally lost. That means it was using this circle, means it was influencing through a gamma motor neuron. So this experiment indicates that when we are removing the afferent sensory nerve in decerebrate animal, where influence is coming from cortex and basal ganglion, rigidity is lost, means it was acting on gamma motor neuron, because gamma motor neuron is working through sensory nerve only. So in mid-colloquial decerebration, there is no spinal shock again. Rigidity increases as compared to decortication, because in decortication only cortex is removed, basal ganglion was there. But in decerebration you can see here, along with basal ganglion also gone, so that's why rigidity is increased. Two influence have gone. Loss of all sensations as thalamus is disrupted. Hypothalamus function affected because hypothalamus is also again affected. Inability to react in terms of past experience, so learning again is affected because cortex is the main center for learning actually. Rigidity release after deafferentation, because these are all influencing the gamma motor neuron. Through gamma motor neuron rigidity was there, but as the sensory nerve is cut off, rigidity is lost. So it indicates that all these tracts which are coming from or influencing from the cortex and basal ganglion are ending on gamma motor neuron. Now third one we'll do experiment now. We are doing ischemic decerebration. We'll ligate the basilar arteries so that blood flow to everything, cortex as well as this cerebellum is gone. So in this now additional we are damaging the cerebellum also. Means out of the three influences, that is cortex, basal ganglion and cerebellum, all three will be affected now. So it is called as ischemic decerebration. Now see in this what will happen now, all the negative influence have gone. So rigidity is very much increased in this. Now in this, if we are now cutting afferent nerve, rigidity persists. Now here it proves that this cerebellum which is acting here or influencing this descending tract is ending on alpha motor neuron directly. That's why rigidity persists even after the afferent nerves are cut off. So ischemic decerebration, rigidity is further increased, hypothalamic function is affected, inability to react in terms of past experiences, rigidity persists after deafferentation. So in decortication, rigidity is mild, decerebration is moderate, and ischemic decerebration is severe. So these are the basically three levels of supraspinal regulation of muscle tone. So supraspinal regulation, basically cortex, basal ganglion and cerebellum, all three are influencing the muscle tone. So applied aspect, hypotonia and hypotonia we have learned during our previous lectures. So this completes physiology of muscle tone.